Our Lady of Mercy Community Outreach Services have been serving the Low Country, particularly the Sea Islands and the Charleston eastside area, for many decades. Today, I talk one-on-one with the Executive Director of this organization, Jermaine Husser, for this edition of Quintin's Close-Ups. And if you haven't already, subscribe to my YouTube channel and like Quintin's Close-Ups on Facebook. Jermaine Husser, welcome to Quintin's Close-Ups.
Thank you, Quintin, for having me.
Oh, I appreciate it greatly. Me and you have a great history. Of course, I had you as one of my panelists for my 2007 Stand Up to End Homelessness and obviously poverty in Charleston many years ago. And now, since that time, I should say, you've been busy in the community doing a whole lot of things. As a matter of fact, right now, you are the Executive Director of Our Lady Mercy Community Outreach Services, which has been an anchor for this community in the Sea Island community since 1989 when Hurricane Hugo hit. And of course, you have branches on the east side of Charleston here, and actually out in the Sea Islands as well. So tell me right now, Jermaine, what's new, what's now with your organization?
Yeah, Quintin, I think the challenge for us is making sure that we meet our neighbors where they are. And there's so many transitioning challenges from the pandemic that are still impacting families at a really at a grassroots level, Quintin, where they're having real conversations around the table around how inflation has impacted them with shopping at a grocery store and how inflation has impacted even housing in our community. Affordable housing, attainable housing, whatever you want to call it, Quintin, at this point in Charleston, South Carolina, just is non-existent. And so we're really in partnership with other organizations to find out how do we help our neighbors figure out these table stakes, because these are basic necessities like food and housing are basic necessities that many of our neighbors are struggling to even maintain.
Wow. And I want to dive in that in depth in just a second, Jermaine, but let me ask you, what conversations are you actually having with your partners about these issues?
Yeah, how we can jointly come together, Quintin, and pull our resources from our donors and our grants to look at ways that we can help find affordable places for our neighbors to live. And so there's a housing consortium that has been developed through Neighbors Together that we are partnering with, as well as we're looking at other ways to make sure that our pantry stays stocked for our neighbors. And so we're doing more food drives, and we had a policy where we only did it every other month for shopping. We're moving to now once a month an individual can come and shop in our pantry. Hence why we need more support from the community, more resources to come in to make sure that we can maintain that additional workload and traffic through our food pantry.
So what's the traffic like right now with all of these issues going on in this community?
Yeah, I would share with you, Quintin, just from last year up until this point, we've seen an 80% increase in the number of neighbors that need our services. And so we're just trying to be intentional and more inclusive about what we're offering to the community as well, Quintin. We take diversity, equity, and inclusion here at Our Lady of Mercy serious. And so we're even looking at culturally appropriate foods for our neighbors so that we just don't have in our food pantry something that they're not going to use, because we have a client choice pantry. And so they get to walk around in our pantry and choose and select the items that they most like. And we serve our heavily Latino American population here on Johns Island. And so making sure that we are intentional about just making sure we have those culturally appropriate foods to where they feel included and they feel like we are in their plans when we talk about basic and emergency needs.
And what exactly are those basic and emergency needs for those particular people, particularly the Latino community?
Yeah, so we've been very intentional about our English as a second language class, which is very popular here on the island, Quintin. We're one of the few organizations that do it. We started a day class. We had 21 people start, which shows you the magnitude of how important this class is. And what we heard, Quintin, was, number one, why they're in the class is so they can better communicate with their child's school. And then also they can better get a better job or a promotion at a job because they can now speak fluently with their boss or their supervisor. And so, looking at those aspects of how do we make this inclusive, we're also looking at scaling it to evening classes, because a lot of our Latino American families are working during the day, and so they have to take time off to come to this class. So we need to be more inclusive about when we offer classes as well. And so we're looking at non-traditional hours as well to be able to serve our community and our neighbors that have it most need, especially our Latino Americans.
And how many jobs have been actually created because of these classes?
Yeah, we're in the process of working on that right now and collecting that data. This program was discontinued right prior to the pandemic, and so we're just now ramping it back up, Quintin. And so really looking forward to seeing those data points, that impact points that you're talking about, as far as how many lives are we able to change through our ESL program. But we also have an Empower program where we are working with individuals in the workforce, and we do career fairs every quarter, and we as well as do mock interview skills. And so just through that process, we've helped 46 individuals this past year attain employment, which we're very proud of.
With those 46 individuals, Jermaine, where exactly are they coming from?
It spans the gamut, because we have a location downtown as well as in the Sea Islands. And so we say that we serve communities from downtown all the way to Edisto Island. And so within that footprint, anyone who comes to us for services is who we provide our resources to. Even if you come from outside of that, let's say you come from North Charleston or West Ashley, we'll try to make sure that we serve you as well and make sure that you get the resources that you need. But then we'll share with you a partner that's closer to you in that region that might be able to serve you better than we can.
So how many partners do you have here on the east side versus partners on the Sea Islands?
Yeah, so for the Sea Islands, we've got quite a number of partners like Habitat for Humanity, Wesley United Methodist, Barrier Island Free Medical Clinic, which is a major health partner. So we've got a lot of partners here on the Johns Island area. And downtown, you got your Charleston area senior citizens that we partner with, and you've got 180 Place. And so we've got great organizations downtown all over that we're just continuing to try to build those intentional relationships with, so that we can do warm handoffs, so we can make sure that we are building continuity in our service. When it comes to this continuum of care, Quintin, what we found out is that it is much more beneficial to the client if the agencies begin to talk and help to solve the challenge with that partner or that neighbor together, than us trying to do it in silos.
And what are those intentional relationships, exactly what those results are?
Yeah, so it's about building an MOU. And so with, let's say, for instance, Habitat for Humanity, we've got an MOU with them, a memorandum of understanding. And so we'll send someone to their shop to get a roof fix. And so they'll work on that individual's roof. And then once they've completed the work, they'll send us an invoice. We'll pay that invoice. We'll have a joint celebration of the work together, because that was Habitat for Humanity leaning in with us, and then we're paying for that service through a grant that we received. And so that's the kind of partnerships that we're really working on. Is it's not just a win for us, but it's a win-win-win. It's a win for the partner, it's a win for our neighbor that we served, and it's a win for us.
Oh, absolutely. And how many grants have you received in the past 6 months to help you with these resources and the incoming issues?
It's been countless, but I will share with you, it's been well over $300,000 that we received in the past year for grants to be able to serve our neighbors in need when it comes to basic and emergency needs.
And you talk about those clients in total, since you've been executive director, Jermaine, how many clients have you all actually had to receive and actually helped?
Last year, we served 6,000 neighbors in our community, Quintin.
Wow. And I mentioned it earlier, obviously you operate 2 campuses, one on Johns Island, and of course, we used to call it when I was growing up on the east side in the 90s, Sister Mercy.
Yeah.
But let me ask you, out of those 2 campuses, Jermaine, which one is actually the busiest for you all?
I would say, I say it was a mix, Quintin, because we serve differently in each community. So for instance, downtown, we've got the soup kitchen versus we don't have a soup kitchen on Johns Island. And so our soup kitchen really is the heavy load lifter downtown, because we've got a lot of transient and homeless neighbors downtown that need a place to go get a hot meal. But here on Johns Island, it's heavily Latino Americans and African Americans that are actually working and come in, and they can't make their ends meet that month, and they need our support. And so I would say that we're busy in both locations. Can we do more intentional work in each location? Absolutely. And that's what we're working on as a team, because we're not perfect in our strategy. But every single day, I can tell you we're working on it hard to make sure that we are staying relevant to what our neighbors need.
Okay, then, what are your strengths, weaknesses, and opportunities, and even threats?
Yeah, I think the biggest opportunity is, as I shared, around housing. We need to find out what our role is in the housing space. And is that us, helping to build affordable housing? Is that us, getting more resources so that we can help pay for nights for someone to stay in a temporary location, because temporary housing is just not available. And that's what is really needed, is that kind of transitional housing in our community to help individuals get on their feet. And then food, just kind of helping our neighbors continue to maintain their food budgets. I mean, that's significant. And so us having the resources from our community to be able to stock our food pantry at both locations is an area, I would say, of need and an opportunity for us, and how we continue to get that out. But it's also a challenge to maintain it.
Oh, wow.
And then also, how do we continue to scale our services, because our need is growing. And so, we're getting neighbors from North Charleston. We're getting neighbors from even as far as Goose Creek sometime, and looking at how do we not turn our neighbors away, and how do we continue to still serve them in a thoughtful and humankind way is what we're trying to focus on.
Wow. I want to break that down. Well, let me ask you this, then. What is the typical food budget in today's society?
Yeah, that's a good question. I know for my household, Quentin, it's well over $800 a month. And so, a family of four for me, that's significant. And so, I can't imagine a family of four and they're making minimum wage. How do you maintain that? Is difficult. And so, every single day we're trying to make sure that we, talk to legislators and we talk to employers about paying people a living wage. And that's the key, Quentin, is paying people what they're worth. And that is a living wage. They deserve to have a living wage wherever they are. And employers need to get that. And I think the pandemic showed that a lot of people did not go back to jobs that were paying minimum wages, because they knew that they deserve more than what they were getting.
What exactly is the magnitude of disparities and inequities with your future plans for your organization because of COVID?
Yeah, I think it's just getting people back out, Quentin, back into, connecting again. And that's where we saw, so many people got, comfortable, is that distancing. And we distance ourselves from each other so often to where trying to re-immerse back into society. I mean, I had to do it for myself. And I'm not sure how you, transitioned from the pandemic, but I had to get adjusted to just getting back out and seeing folks and shaking hands and connecting again. And I think that's where we as an organization can help our neighbors, is that we create that in warm and welcoming and inviting space to where our neighbors would want to come in, but also creating a relevant service that they need, whether it's around basic and emergency needs, whether it's healthcare, as we do here with dental and OBGYN services, or as if someone's looking for a new job, or they need their child to be in an after-school care that is safe and secure and going to challenge them socially and emotionally and help them with their math and reading scores. We run the whole gamut, Quentin, and so we want to make sure that all of our campuses feel warm and welcoming and open so they can connect again. We want to build those connection points. And if that means having a movie night at our location and bringing people out and having a good time, we'll do that. We do cookies with Santa in December to bring kids out and their families. And so we'll keep having those type of events so that we can draw in that connection, so we get people back used to just touching and high-fiving and just sharing their needs.
Oh, absolutely, absolutely. I was able to do the high five during the bridge run last Saturday. That was fun. But let me ask you this, Jermaine. How many people are actually coming to you daily to actually look for jobs in these areas?
Yeah, I would say Keely and her team are looking at a weekly rate. I would say 5 to 10 individuals a week are coming to our facility
Wow.
in need of assistance for career services. We actually are bolstering that division because we are seeing more need. And so we just hired a career service manager as well to help Keely with that work. And so because we're seeing it grow and we see there's a significant need for individuals to change careers so they can make that living wage, we're bolstering our services here.
Wow. And I wanted to ask you this. What is that space, particularly housing space, for these people who are living really in that minimum wage circumstance?
Yeah, the United Way has done a great job of packaging this. Quintin, if you've not spoken to DJ Hampton or Ilza Astad over at United Way as of yet, they call it the Alice. It's an Alice project, and so it's people who fall above minimum wage, who are supposed to be in the middle class, that just at the end of the day don't make enough to make ends meet. And so we're trying to create those kind of programs and messaging, Quintin, that share with our neighbors that when you're at this point in life, we're here for you, not just for our neighbors who you believe make less than minimum wage. For example, we had a teacher who came in a couple of weeks ago, and she felt sad that she, number one, had to come in because she felt like she was taking resources from someone else that deserved it more than she did. Now, her husband works for a landscaping company, to not be named, and his work is sporadic. And so their household was in a stretch moment there. Not that they couldn't maintain it over time, but he wasn't working at the time because of it's seasonal. And so she was carrying the weight and the load of the family. So she came to us, and she felt like she was undeserving of it because she felt like she was taking food from someone else. And that's not the messaging we want for our neighbors to take away. Any one individual in our community is one paycheck away from needing our services. And that's the majority of us. And so we don't want people to feel like they're less than or that they're not worthy to receive services. Our Lady of Mercy is there for everybody. We love our neighbors, and that's the way the sisters set it up. Our founders is that we love on our neighbors.
What is the biggest difference about Our Lady of Mercy community outreach from the time that the founders developed this to right now?
I think what holds us together is what I just talked about, is that spirit of love. Quintin, that they set up the foundation for us when they came out to Johns Island over 30 plus years ago, as you mentioned. And this happened right before Hurricane Hugo. If you remember, this is when these sisters came out here, and they just wanted to find out a way to help. And all of a sudden Hurricane Hugo hits, and it's like, slam, now I know what I need to do. They were up on roofs, helping to repair houses and roofs. They were handing out food. They were helping with financial assistance because, I was here during Hurricane Hugo, Quintin, and I was in high school. I didn't know the magnitude of how much it impacted the Lowcountry, but I do know what I did see at that time was neighbors helping neighbors. I was out there cutting trees down. We were going to take apples and oranges to neighbors because my mom made sure we did that. And that's what the sisters did 30 plus years ago. And still yet today, Quintin, that's what we're still doing. Whenever our neighbors need us, we're there with the basic necessities, but then we also are helping them to build plans on how they become self-sufficient. How do they build wealth with their families? And I think that's the uniqueness of where we are today, is that empowerment piece, is that we're just getting savvier and figuring out how do we help our families become more empowered.
How do they become empowered right now?
It's through education and knowledge, and it's us helping them get access to that knowledge, Quintin. And so, for example, we were just on the phone a couple of days ago talking to a group out of New York that has started a financial literacy program that really helps individuals in 6 weeks build them empowerment behaviors in their finances to begin to build wealth. And so we're in the process of talking with them to figure out if we can become a train the trainer or utilize their curriculum to help our neighbors reach that area of financial empowerment. And so we're just continuing to try to be as smart as possible and reach into other neighborhoods around the country and the world to see what resources are working and that they have data that shows that is working before we bring it back to our own neighborhood.
What trends are you currently looking at when it comes to those types of programs?
Yeah, financial literacy is a big piece, financial empowerment, wealth building. We see that's a way for families to build generational wealth, Quintin. And so we're wanting to be wealth generators. And then secondly, the piece of it is around how do we build collaborative housing efforts, whether that's, again, us helping to fund some of affordable housing or we help build it ourselves. What is our role in that space? And then making sure that we have policies, not only in our state, but also in our country as advocates to make sure that our neighbors feel empowered through the electoral process. And that's by having policies that work for our neighbors that do not fight against them. And so that's something that we're working hard on every single day.
What policies would actually be ideal for your organization and the neighbors that come to you for help?
So, for example, I know that in North Carolina they've been partnering with with organizations like ours and hospitals to get neighbors a box of healthy food from organizations like ours because they see them as patients. Now you have hospitals and organizations like ours working together for the care of a patient. And so if hospital systems and organizations like ours can actually work together, and this is a government program, Quintin, why can we not make that legislatively something federal to where it's happening in every state, to where every hospital system is working with organizations like ours to care for our neighbors collectively together? Those are policies that I see that work. Is not giving a handout. It's helping our neighbor become more self-sufficient by working on their health. If they're unhealthy, they can't work. If they're unhealthy, they can't take care of their families. And so by collectively coming together with the health system to make sure that we provide nutritious food as well as nutrition education to our neighbors is one of the most impactful things that we can do. And that could be a federal program across the country.
What health inequities do you see here in the Low Country?
I mean, again, it's our food deserts, Quintin. I mean, there's still a big food desert smack dab in the middle of North Charleston, right around that Cosgrove Rivers Avenue area, Quintin. I mean, that's how long has that been a food desert? And so, those inequities still exist. Those families have to go elsewhere outside of their community to get fresh produce, to get, milk, and to get diapers for their family at a reasonable cost. If you're in that community and you go to a little mom and pop store, it's going to be a higher rate. And you're not going to have the same variety as you would at a grocery store. And so that's where I see those inequities exist, Quintin, still in our neighbors, is we have those gaps in service.
What other gaps do people are actually not seeing right now, Jermaine, when it comes to that?
Yeah, I think it's, food deserts was a buzzword, 10, 15 years ago. And I don't think people still realize that we still have large amounts of food deserts still in our community. We also have these education gaps in our community that, a lot of the schools up and down I-95 corridor still haven't been changed, still have not been addressed. That corridor of shame still exists today. And we still have work to do in those areas and gaps in education in our region. It's hard to afford even childcare right now, Quintin. You're not sure, if you can pay to go to work, or you can go to work, or you can afford to send your child to childcare so you can afford to go to work. That's what our neighbors are dealing with, is just affordability of childcare. And so some families have chosen for one spouse not to work while the other does work because they need childcare at home. And that's difficult. And still try to make ends meet and still try to have fun, Quintin, because life is not just all about work. Families want to have fun too. They want to engage their families in some social and emotional upliftment as well, and they deserve that. They deserve to live their piece of their American dream.
What ideal programs in relation to childcare do you want to bring to your organization?
Yeah, I think that's something that we're still figuring out, but we do know that we have after school care taken care of, Quintin, and so with our after school program and partnership with Angel Oak Elementary, it's been going well. Our results have been staggering. I'm very proud of our team and the intentionality that we take with that program. Last year alone, we helped increase reading scores by 93%, and our math scores increased by 86%. And so we've got the after school care taking that that part of it. Now we're looking at can we actually turn this into a different program to where we have something summer, or we have something that would be even more robust for after school program or childcare.
Wow. And lastly, how many of those children actually how many children do you all take care of within your organization, I should say?
With the capacity of our 2 education team members and then our volunteers, we can service 16 at a time.
Wow.
And so we have 16 going through our session right now. And again, we do it every semester, except for the summer semester when they're off. But we've seen tremendous impact, and we continue to want to scale it. But if we can have more volunteers and more team members that we can afford to bring in and a larger space, we will grow it so that we can reach more of our neighbors.
And speaking of which, what is your approach to expanding your organization's role and influencing local systems that actually help and create and sustain equitable and inclusive communities?
Can you ask me that one more time?
Yeah, what is your approach to expanding your organization's role in influencing local systems to actually help create and sustain equitable and inclusive systems?
Yeah, it's around advocacy, Quintin. Again, our role in advocacy and having our voice in that, and partnering with, the Appleseed organization or other organizations that are dealing in policy. We need to have our role in that. We need to have a voice because we serve our communities, and our communities have a voice, and we need to be that for our community. We've been big friends with Jim McBride, who's now our city councilman here on Johns Island for the first time in its history. Johns Island now has its own city council member, and he's been tremendous. He's already sent me a couple of invites. He's having a town hall next week right here at Sunrise Bistro. He's having community meetings, and so that in itself starts the process of making us feel more involved, more inclusive, by having our voice now heard at a city hall level that we hope will then get to state and then hopefully to federal. So having someone in our community that we can touch, that we can talk to, that we can shake hands with has been, I think, the great start to how we build those programs.
And what else do you want to build on with your organization next?
Yeah, Quintin, I think, in the daily grind, just figuring out, how do we build a strong team that can be innovative and creative enough to where we meet the needs of our neighbors and stay relevant. Quintin, I think, everybody's having a tough time finding talent all over, and that's every industry. We're seeing it in our own industry, nonprofit industry, Quintin. Not a large number of people are still going into nonprofits. And so we need to create spaces of belonging that people